Are
Yeah.
there any other studies that or news that came up at the conference that was particularly interesting?
So GLP-1s I have been prescribing for many, many years since I've been in practice. We've seen an evolution of GLP-1 therapy from a medication called Byetta, which was a twice-a-day injection and it had a lot of side effects, to then a single daily injection called Victoza. And then, of course, everyone knows about the Ozempic boom. Ozempic was launched in December 2017. I don't ever think I'll forget the year or the month. Many of these medications, and now there's many, I prescribe about 11 different types of GLP-1s or GLP-1 and GIP-1 combos in my practice. These medications are providing not just glucose regulation, but they have indications for obesity, cardiovascular risk reduction, chronic kidney disease, and obstructive sleep apnea. At the conference, what's been really exciting is different types of GLP-1 therapies research has been released, and I've had a chance to kind of be in the room when that data was released. So we do have a combo medication that's a little bit different. Yesterday, a clinical trial on a medication called Cagri Sema was released, and it was also published in the New England Journal of Medicine. Cagri Sema is a combination of a GLP-1 semaglutide at a fixed dose of 2.4 milligrams mixed with an amylin analog, which is essentially also a hormone that can be deficient and help regulate glucose and the way it spikes after eating and appetite suppression. So this medication is showing weight loss 20% or higher. And it's also showing a lot of other good data that could be like protective cardiovascular disease. And it's just an exciting time to see multiple options for people living with diabetes that maybe didn't respond to one therapy. And this is like another option for them. So that's been really exciting.
So with all of these new options and technology and combinations of things, the dreaded question is always, how does insurance handle these options? What
Of
are you
course.
finding with your patients?
Yes. So I think I'm glad you asked about insurance and money because I think that's half of our job. And most of lay people or the general population, patients don't know the burden that it poses on clinicians. And of course, without getting into any politics whatsoever, I would say the burden of a lot of what's called prior authorizations and appeals and getting medications approved is a huge burden on the healthcare system as a whole. And it takes a lot of time and energy. Rule of thumb is the newer a medication is, the least it's covered on insurance plans. So once a clinical trial is released, which is why the ADA conference has been so exciting, because once we prove, hey, this is working and this is working like non-biased, this medication is working, it then goes to the FDA for approval. Once that medication is approved for that indication, insurance plans will start picking it up and putting it on their policies, but it's a very slow process. So a lot of times people will get all this information and they're like ready, like, hey, I want this medication for this indication, but yet it's not on their insurance plan. So that can be frustrating. There is a lot of navigation on the clinician side to figure out what's covered on your insurance plan, what's not. Fortunately, especially speaking about GLP-1s, there is cash pricing options available to patients. They still do need a prescription, but we can send prescriptions like Wegovy for weight loss directly to the manufacturer Novo Nordisk for a cash price. That way patients can still have access. And also Zepbound, which is made by Eli Lilly, can be sent for cash pricing for weight loss or obstructive sleep apnea to Eli Lilly. So people still do have access to them even if they're not yet on their plan. So that's the positive thing about it.